All right, welcome back. Now, a recent national survey found that 1 in 5 boys and 1 in 4 girls in South Africa are currently overweight or obese. In this next story, we hear from a dietitian who explains why South Africa's youth are rapidly packing on the kilograms. And we also hear from a mother who says unhealthy food from school tech shops is a major culprit in making the nation's children fat. Let's take a look at this.
Childhood overweight and obesity is a problem globally, not only in South Africa. The World Health Organization reported that between 1990 and 2013, childhood overweight and obesity stats more than doubled. In South Africa, the stats are also quite alarming. In a recent national survey, it was reported that 1 in 5 boys and 1 in 4 girls is overweight or obese. South Africa has what we would call an obesogenic environment, which means that there are many factors contributing to childhood overweight and obesity. For example, there's been a history of poverty and a lack of education around health, and that coupled with an increased urbanization, a more sedentary lifestyle, and more exposure to things like the advertising of junky foodstuffs and availability of those foodstuffs for children to purchase daily. All of those factors together mean that children are more vulnerable to being overweight or obese.
My name is Jacqueline Roos. I'm married with 2 kids. Jody is 14 and Zia is turning 7 years old. For Zia that goes to primary school, I normally pack her 2 slices of bread. She likes cheese, she likes bologna. And then Jody's different. Jody's at high school. So she wants money to go to the tuck shop to buy chips. She does not want to take sandwiches.
I usually eat from the tuck shops. In the morning I normally buy my sweets, and then intervals I buy my chips. Sometimes I drink sodas and fizzy drinks.
She wants to go to the tuck shop together with her friends at intervals and buy the chips and buy the fizzy cool drinks and things like that. It's cheap enough and it's affordable for them to buy.
Tuck shop versus lunchbox, it very much depends on the tuck shop. So if the tuck shop is extremely well managed and the school is great about ensuring that there are healthy options there and that the unhealthy options are actually absent, then the children can make choices around various healthy options. Children are going to buy sweets and chips if those are available and they have money to go to the tuck shop because they taste nice. So if those options are there, the children will buy them. If they're not there, then children will buy other things.
I do think kids have more access to fizzy drinks and sodas and chocolates and sweets because it's available to them at school. Even on their way to school, the tuck shops is open, so even if the school doesn't have one, they can get one on the way to school. So I do think that even if the parents put in a healthy snack, rather not give them spending money because they're going to end up buying sweet things that they should not even do.
Well, the awareness that we have now is that if obesity rates continue to increase as they are now, there will be about 3.91 million children who are overweight or obese by 2025. So if we don't intervene now on all levels, so individually in our homes and as a government and as schools, then we will have an increasing problem as these children grow up and as more children are coming through the system.